Hello viewers, I am Dr. Shailesh Kumar Garge. Today we'll talk and discuss about few of the questions asked in our videos in the comment box by our viewers. So let's see. This is regarding the lymphatic malformation. One of the patient has asked in Hindi. सर मेरा बेटा 1 ईयर का है, उसके हाथ पर लिम्फेटिक मालफॉर्मेशन की सर्जरी हुई है, पर उसका हाथ अभी भी स्वेलिंग के जैसा ही है, क्या करें? सो दिस पेशेंट इज सेइंग दैट सिंस वन ईयर बैक द पेशेंट हैज़ अंडरगॉन फॉर लिम्फेटिक malformation surgery, but still the swelling is there, and what to do? So another patient for the similar question has asked, sir, can this conversation also be done in English so that more people can understand? Vascular issues are increasing now and people are reporting more. So yes, definitely these vascular malformations, the incidence is increasing. Maybe the incidence there, but they are because of our technology now, it is more and more detect, and the treatments are available, so patients are coming more to different places where the treatments are available. So the question is, like, lymphatic malformations, sometimes they are focal in the sense they are that one place, sometimes they are very diffuse. So most of these times we see them in the neck region and face region, and also in the upper arm and axillary region, but they can occur in any part of the body. Usually these lymphatic malformations, they are congenital most of the times, especially if they are found in the children's, like in your kids, but they can also be seen in the adults, maybe due to some trauma or previous surgeries, or some diseases where there is accumulation of the lymphatic fluid. But this malformation, when we call it as malformation, the word itself, it's an abnormal formation of the lymphatic blood vessels. So there are 3 types of blood vessels. The one is the artery, which carry the pure blood from the heart to the rest of the part. Another is a vein that carries the impure blood back from the peripheral part back to the heart for purification. Third is the lymphatics. So these lymphatics, they carry the large molecules, like when oxygen, glucose and proteins, they move out for the cell to supply them, and rather than coming back into the blood, they go into the lymphatic part because of their larger molecules, and slowly these lymphatics ultimately they go and drain into the major vessels in the neck or in the chest region. So these lymphatics sometimes they have an abnormal connection, like in the venous malformation they have abnormal connection, so lymphatics also will have an abnormal connection. So so most of the times these are by birth, congenital. Maybe if they are very large, we see them in the early childhood, as soon as they are born, but if they are very small, but as the baby's height and age increases, they can grow in size as the baby grow, and they can become more obvious, and then you determine in the later stage of the life. So this can happen. Usually the treatment in the olden days, it was surgery to remove the focal lesion. If it's very wide and extensive disease, then it's very difficult, like in the case in the patient who has undergone this surgery, but still the hand swelling is still seen. So surgery, because these vessels are like roots of the trees, they are spread deep into your muscles and bones and different parts, so it's very difficult to remove them completely. So even if you remove them, then the normal lymphatics and the lymphatic drainage, the fluid which is coming from the hand or to go to the heart, that can also get impaired, and the lymphatics will keep collecting and the swelling can occur in the hand. So the surgery, it's good for the smaller and the focal lesion, but if it's a diffuse and extensive, surgery may not give you complete results and may not give you a better results. So there is considering this, the medical research has undergone, and now rather than going for a more extensive and surgeries, these treatments are treated with a sclerotherapy. So foam sclerotherapy or bleomycin therapy can be done for these patients, but these are slow results, because it is with the multiple settings we have to do. We cannot give you the injection of foam sclerotherapy, the injection at once, because considering the patient's body weight we have to give, because these have effect on the kidneys and livers, through which this drug are excreted out of our body. So if you give the larger dose, considering you want to get it cured at one in one session, so these can damage your the other organs. So these require a multiple sessions. You need to have patience, but the advantage here is it's a daycare procedure most of the times, unless the baby is very small or anesthesia is required. And the cosmetically also the results are better, so patient don't have to go for these wild scars, and the dysmorphing of the limb can occur if the surgery results are not good. So hope this will solve your doubt and question. And if you have any patients, if you have any other doubts or questions, please put them in the comment box. I'll be happy to read them and answer them. So the next question is, sir, lymphatic malformation surgery के बाद क्या cure होता है? So as we discussed now, this patient is asking that if we do the lymphatic malformation surgery, does it cure completely? So as I said, that if the lymphatic malformation is only at one place focal, then possibly the surgery have a better results and you can remove it completely. But if it's extensive, spreading in the neck and chest region and in the arm, then probably the surgery results are not that good or that great, and you can have the, because of the scarring and all, you can have the different shape of the limb rather than being a smooth round shape. So shape also get distorted. So it depends upon the stage, grading and severity of the malformation. The results are depend on that. So if you have any other doubts or questions regarding the vascular malformation, please put them in the comment box. I'll be happy to read them and try to answer them in our next video. Thank you.